lifelong Orion resident, more or less, more than 50 years now. So we've lived in the community in Keatington, raised our children here, gone to church here, been involved in various ways in the community. I'm also a Chrysler retiree, and because of financial problems and Chrysler going bankrupt and problems in the auto industry, I ended up getting pretty heavily involved in issues of pensions, health care, Social Security, and Medicare. And so that's what I want to talk about today, because some of these issues, they're crucial to some of your neighbors. Maybe you're lucky. You've still got your pension, you've got your health care. Some of your neighbors have lost them. And some of our children may not have these benefits in the future. So it's something as seniors we need to be familiar with and pay attention to, and maybe even take action when important issues come up. So the title is Beware and What Seniors Need to Know to Protect their future and their families. First of all, with regard to Medicare and Social Security, the bottom line, these are government benefits, and probably for current retirees, they are relatively safe. Most of the discussions that you hear in the government are minor changes for current retirees. Things like changes in cost of living. Well, if you're 65 years old and the cost of living only goes up a few percent, it's not going to affect you much in the future. The other good news about Social Security and Medicare is there are national groups that are well organized and well funded that are trying to protect our benefits. So like AARP, and there's another one called the National Committee to Preserve Social Security and Medicare, and Medicare Rights Center, and there's a whole bunch of other ones in Washington, D.C. as well, that are focusing on these benefits, these retiree benefits. So the real problem is what I mentioned before, is our children and our grandchildren. And there's a lot of debate, but is Social Security necessary? Should it be privatized? Can the government afford to continue to offer health care benefits when the cost of health care is rising so high? Those are the issues that are really important. In our case, we have some 50-year-old children now, you know. We're in our mid-70s. They're going to be retiring soon, and they've been contributing to these plans all along, and, you know, are the plans going to be there for them the way they are for us? I guess that's the real issue. It's obvious that it's politics, and both sides, in my mind, are off base. Democrats, they say solve the problem by raising taxes. The Republicans say solve it by cutting benefits and changing the programs. And they have a real good argument. They say, you know, the nation's going to go broke. But the real need is for nonpartisan solutions, both sides coming together and not continuing to blame the other side and, you know, no name calling. Really address the issue. As far as Social Security goes, the issues are relatively modest, and some tax increases and some small changes in retirement age would solve the Social Security problem. But the real problem is healthcare system. That is a major problem, and healthcare costs have been rising at 6 to 8% in the past. Now, during the recession, they stopped rising. That was the good news, that healthcare has not gone up in the last couple of years the way it had before. But for more than a decade, healthcare was going up at 6 to 8%. And when you multiply that over a number of years, that's when they say that the government just can't afford to continue to pay those kind of benefits to, you know, the baby boomers when there aren't as many people working in the future. So that's the two big programs. But the programs that affect most of us more directly are pensions and health care. And probably most of us worked, or our spouses worked, and we do have a pension. And we either have health care from our company or our employer, or we lost health care, which means it is a problem. These benefits are really in jeopardy. Most pension plans are underfunded, which means if the company or if the government goes bankrupt, they don't have the money to pay all of their benefits. And the health care benefits were never funded like pensions, so they are revocable at any point in time. So an employer or a government agency can just decide that they have to, save money, or they want to maintain taxes or something, and they can eliminate your health care benefits at any point in time. I've provided a handout from the National Retiree Legislative Network. This is an organization that, in addition to Social Security and Medicare, is very concerned with pensions and health care issues. And I'm not going to go through it today. It's 15 pages long, but this is an organization, it's a smaller organization that is especially focused on pensions and health cares. The last point on the chart there, as most of us know, future employees and current employees, a lot of them are losing pensions and are losing health care. So in the future, pensions and health care will even be a bigger problem as they have to address their retirement with whatever savings they accrued during their life. Here are a few examples of some of the problems. Industries revamping their health care. Delphi salaried retirees in particular were hit hard because of pension rules. Delphi was a subgroup of General Motors, and many Delphi employees who became Delphi retirees maybe worked for General Motors for their whole career, 25, 30 years, and then they got transferred to Delphi. Delphi went bankrupt. The pension plan was not fully funded, and some retirees, some of the younger retirees, lost nearly all of their pensions. And because they were early retirees, and it was during a recession, they couldn't get a job either. So they lost their pensions and they couldn't get jobs. The Detroit bankruptcy is another case of, this is the biggest city in the country that's experienced bankruptcies so far, but luckily most of the pensions were preserved, but they did lose most of their health care. And a new thing has come up. It's called pension clawbacks. And this is an interesting situation, but in the case of the Detroit retirees, the pension plan paid them bonuses. And part of the settlement is that they're going to claw back these bonuses. So these retirees have to pay back, now that they're retired, they have to pay back the pension plan. And clawbacks are occurring in some other cases as well, where maybe the company miscalculated your benefits, and then later they find out the error and they take them away. That's a real problem for the individuals affected. Some of the things that we found out when Chrysler and GM went through bankruptcy are obvious things that should be changed. For example, they have a committee that covers bankruptcies. They have a bankruptcy judge, and they put everyone on the committee, not the salaried retirees. There's no right for retirees to be on the bankruptcy committee. Another thing we found, it's different if you're working and they cut your benefits, and if you're retired. It just makes sense that employers should not be able to cut benefits once you've retired. Pretty simple, If they want to cut employee benefits, well, the employee can work another year or two, or they can negotiate because they're still employees. But once they're retiree, you're cut off from the company, and that just doesn't make sense. Another thing that doesn't make sense is some of these companies go bankrupt and reorganize, and yet they're still around. GM, Chrysler, they're still around. A few years later, they're making lots of money, but the retirees are gone, And they've cut their commitment with their retirees, and even if things get better later, you know, that's water over the dam. It would seem like there should be some commitment if the companies begin to recover. If they start paying bonuses, shouldn't they be, you know, trying to pay a little bit more for the retirees? Another area that's obvious is drugs. As most of you know, as seniors, we have a Part D drug program that's funded by the government, but there is a law that says that Medicare cannot negotiate with drug manufacturers for the prices of the drugs. Now, isn't that crazy? Uncompetitive. I mean, no one benefits but the drug company. And yet what that means is that each drug plan can talk to the drug company and try to work out whatever deal they can work out. But Medicare, who covers millions of us, can't do that. They can do it for veterans, which is another funny thing. So the VA Association can negotiate prices for drugs. So veterans pay much, much less, and the government pays much, much less for veteran drugs than Medicare pays for our drugs. I mean, that's silly. Most drugs come from foreign countries, and yet there's a law right now that says we can't import those drugs directly. You can't go to Canada and buy drugs at half the price of US prices, even though they're safe and they're made by the same company and everything else. That doesn't make sense. You know, that's anti-competitive. And another factor on drugs that's really confusing is generic drugs. If a drug, it's protected for 7 or 8 years, let's say, by patent. When the drug goes off patent, frequently what will happen is the drug company will go to the manufacturer of the generic company and work out an agreement, an under-the-table agreement that the generic company won't reintroduce the drug for a number of years. Other problems, and the first one just seems obvious as well. If you work for a private company, once a year you get a pension funding notice from the company. And it's a great big piece of paper with a lot of data, but at some point it tells you how well your pension plan is funded. And if you look at that and it says 100% funded, or 90% funded, or whatever, you say, well, that's pretty good. You know, if you look at it and it says 50% funded, of course you'd be concerned. Well, it turns out that the numbers that they use are based on ongoing pension plans. But if your pension plan gets terminated, if your company goes bankrupt and the pension plan gets terminated, it gets revalued. And so a pension plan that you think was 100% your whole life, and then the company goes bankrupt, suddenly that pension plan is revalued at only 60 or 70% funded. And the retiree loses benefits. I mean, that makes no sense at all. The Pension Benefit Guarantee Corporation, PBGC, is a subsidiary of the federal government, and their rules are the rules that have to be followed on terminating pension plans. Another thing that doesn't make sense, you've heard of the Affordable Care Act, right? And what's one of the big points about the Affordable Care Act? People with pre-existing conditions can buy insurance now, right? I mean, so if you had a heart attack or something, you didn't have insurance, you could go buy insurance now. Well, that's not true for seniors with Medigap plans. So what that means is that those of us that have supplemental coverage called Medigap plans, if our insurer raises our rates or we want to go to a different Medigap plan, it depends on whether we have pre-existing conditions or not. The insurer can refuse to insure us. That makes absolutely no sense at all. Why everyone else in the country has a different set of rules, and yet seniors who normally have a pre-existing condition or two can't change policies. So, you know, that just doesn't make make sense at all. Now, talking about the financial implications of healthcare, and some of these are my own personal expenses. When I retired, I was getting company healthcare, and I keep pretty good track of costs. It cost me about $3,000 a year total. You know, part of it was premium I had to pay the company, and part of it was co-pays and deductibles. Well, I then lost my health care. This is my wife and me, not just one person. In 2012, that had risen to $13,000 for the two of us. If you start multiplying that by 20 years, I hope we live 20 years more. Maybe we'll be lucky and die. And then we won't have to pay, but yeah. I mean, it could be easily a couple $100,000. And I don't know about you, but we didn't put that in our budget for extra health care costs. I mean, where does that money come from? And long-term care is another unexpected cost. I must have been asleep when the company talked about long-term health care because I didn't take a long-term plan. And now I'm finding out that, you know, it's easily $100,000 a year, and a person can be there 2, 3, 5 years. A couple, you know, if it's hard to say, but it could easily be a couple hundred to another $500,000. So these are big numbers, especially the loss of health care, that we have to be concerned about when they talk about small changes, you know, because they make a little bitty change in something, and you say, oh, that's not too much, that's just a little bit more per year. But when these things cascade, and over a number of years, they become significant. And if they're not affecting me or you, they're probably affecting your neighbor. So, you know, we're all in this together. So what are we good at, and how do we take action? Well, most of us, we're very concerned about our families and our future. I mean, that's obvious. We've got the time now. We spend more time with our families. We are more involved with them. We spend more time in activities and socializing. A lot of times that time is spent talking about current events, and seniors, for the most part, vote. So we've got a good base. If we're going to take action against something, these are the good things. What we need to do is critically look at the news. The newspaper every day tells us what's going on in the world, and the magazines that occur, and the TV specials, and so on and so forth. And we need to join senior advocacy organizations, and I've listed a few of them here. Area Aging is an excellent organization. It's probably associated with the Senior Center in one way or another. They are very concerned with nursing and elder care and many of the issues, and they are lobbying primarily in Lansing, trying to ensure that senior concerns are taken care of. The National Retiree Legislative Network, which I gave you a handout earlier, that's an excellent organization. The problem is it's small. It's not influential enough. So I would urge you to consider joining the NRLN because they have an excellent agenda on senior issues. AARP and National Committee, as I mentioned before, they're larger organizations in Washington, but they mostly focus on Medicare and Social Security right now. What we need to do, though, is once we're informed, we need to take action together. And that's where I think we fall down. We need to go from the education and the discussion standpoint to take action. And we can start on the state, you know, the local and the state level, but eventually it's going to have to involve national level as well. And part of that, of course, is the communication, educating each other. Maybe we've got 30 people in a presentation today, but you link up to 4 or 5 or 10 people each, and sharing these issues with your friends and your families. So how do we respond? Well, if you're into email, I mean, that's the best way. If you join organizations, or that's the easiest, it's not the best way. Respond to action letters that you get from Area Aging or the NRLN. And it's very simple. It's just a matter of clicking a little bit on, on your computer, and most of us can do that. Now, unfortunately, because it's so easy, most officials don't really pay attention to emails. So a personal letter is really the way to go. If we took the time to write out a personal letter, it's rumored that one personal letter is worth 1,000 email responses in Washington. That if they see something handwritten, that's something they really pay attention to. The next level is visiting our congressmen and senators and the local office. Jim Marlowe, of course, our state senator, Brad Jacobson, they have offices here. Mike Bishop, I keep thinking Mike Rogers. So if I say Rogers, I mean Mike Bishop, but Mike Bishop is our U.S. representative. He has a local office nearby. It's not much of a problem after you have a meeting and you discuss an issue to go visit him or her, if it happens to be a woman, at their local office. And the last thing is to get the press involved. Writing letters to the editor and getting them published is often an effective way to raise awareness to an issue. So the model for taking action is, if you have email, you keep informed by email mostly. You communicate with your friends and you attend breakfasts and lunches. And then the ideal thing, well, let's take a meeting like this. We have a meeting, we have a lunch, we discuss an issue, then we jump into a couple vans and we go over to Mike Rogers' office and meet with him. I mean, the last step of taking action is probably the most important. That after we discuss the issues and have some understanding of what needs to be done, that we take the added step and we actually go and meet and visit with the person who is representing us. Frequently, we'll be meeting with their staff. We won't be meeting with them. But a meeting with a staff person frequently can be as effective as meeting with the congressman or the senator. It all depends. And frequently, it takes follow-up meetings. But meeting with staff is a good start. So who are we talking about? Well, in Orion, on the state level, Jim Marlowe and Brad Jacobson are the two people that we need to deal with. And there's a special issue right now that I want to discuss and I want to urge you to take action on because it affects all seniors that have Medigap insurance, and that's the pre-existing condition rule that I talked about earlier. Do you recall a few years ago when the state deregulated Blue Cross and Blue Shield? Do you remember any of that debate? It was a couple years ago. And Blue Cross had a special arrangement with the state where they were getting a tax break from the state, and they were subsidizing seniors, senior insurance plans. And a couple of years ago, when the Affordable Care Act came into being, they had to change their model to agree with the Affordable Care Act. So Blue Cross became deregulated. They became like any other insurance company in the state. Now they happen to be the biggest. I think they have 70 or 80% of business in the state, so they're still a giant, but they're no longer a nonprofit, and they're no longer getting special tax treatment. Well, what they didn't tell seniors was that there was $200 million that Blue Cross was providing to seniors who have insurance policies through them, supplementing their payments. And that has gone away. Now, the smart thing is They passed the law 2 years ago. It doesn't go away until the middle of next year. So, they thought that everyone would forget about it. But they took away $200 million from 200,000 people in the state of Michigan. And because of pre-existing condition rules now, when these people get their rate increases, they can't go into another Medigap policy unless they go through the rigmarole of meeting pre-existing condition rules. I mean, it's crazy. Now, we can go into Medicare Advantage policies, and that's a whole another issue. But insurance companies basically want to move you into Medicare Advantage policies because they make more money. So that's one of the reasons why the pre-existing condition rules still apply on Medigap policies. About a year or so ago, we have a group of seniors that meets at, what's the name of the place? CJ's. And Senator Marlowe and Representative Jacobson came to our meeting one morning, and we talked to them about this issue and a couple other concerns, and Senator Marlowe agreed to help us. And unfortunately, it was very disappointing. He agreed to help. He did a little bit last year, and he's dropped the issue entirely. And now he's not responding to our phone calls when we call him and ask him what he's going to do. So this is an obvious thing. It's affecting several people in this room I know have this policy. And they're not going to be able to, they're either going to pay $1,000 more a year per person insurance, or they're going to have to go into Medicare Advantage, which is a different kind of insurance, or they're going to have to stay with whatever Blue Cross offers them. It's just unconscionable that this situation would occur. So that's on the state level. I mean, that's just an obvious thing that we need to take action on. On the national level, Mike Bishop does have a local office. He's a new representative, so he's probably not familiar with most of these issues. He was a state senator before. Of course, Peters is a new senator. He was a representative before. There's a need to educate Bishop and Peters and to have another meeting with Senator Stabenow. So that's something that should be done as well. What that involves is someone getting with their scheduler, setting up a meeting with them, and then getting a group of people willing to go to their office, which either is local or probably in downtown Detroit in the case of the senators. It just seems like Michigan being the epicenter of retirement problems, that our representatives in Washington should somehow be more leaders in trying to make some of these fixes. I'm urging you to start today, and this is just a repetition of what I said before, that I ask you to contact Senator Jim Marlowe. His phone number is up there on the slide, 248-724-2442, and ask him to take a stand and do something for seniors on pre-existing conditions. I've also listed the contact information for the other key people in our region. So, in summary, we're seniors now. Life is a little slower, but we do have an ongoing role in society, and we can review current events, we can communicate and keep our children and our friends involved, and then we need to do the last thing is take action. And although I'm talking about retirement issues, there are other issues too, like the bad roads. I mean, as seniors, we should discuss that, and some of us may want to take action. And car insurance is another key issue. So again, I urge you all to take this to heart and take action. And I think I'm out of time at this point. So thank you very much.